All right. So, kind of just reiterating on those strong counties, and then more than counties. I'll probably just go over the areas. So, our Entrust program is our ACA IFP program. It's HMO. PCP selection is required. I know that's hard to do since you do use Health Sherpa mainly as your management and your enrollment tool. Either that or the HICS network, which is healthcare.gov directly. You can enroll and quote individuals from both of those platforms essentially. Um, so obviously it's an HMO. So for specialists, you're going to need referrals are going to be required. But again, that's just one time. Essentially, if somebody has a chronic condition and works with that specialist, that's probably just the first time they're going through the system that they're going to need that referral. After that, they're going to be in the system, right? And the 22 counties that we service throughout the state of Florida, starting down here with Dade County, Broward, West Palm Beach, and going into the Tampa area, Orlando. Gainesville, which is that Alachua, that middle, and then over to the right, which is Jacksonville, which, surprisingly for us has really exploded. And the reason for that is because we have Baptist Health Network, not only in South Florida. I know there are two different networks, but we also have it up in Jacksonville. And Jacksonville doesn't have too many options. It's been traditionally a Florida Blue dominated area. So I believe that's probably why we're increasing membership because we have some of those hospitals over there that the Blues really are we're late in negotiating the contracts with let's say the Baptists up in that area. We also have a pretty good cancer center up in that area as well. And going forward here, as far as the Entrust, so the Entrust again, it's an HMO. We do have products that attach to dental, pediatric dental with a zero deductible. They can be on the plan up to the age of 19 years old. And then we also have an adult dental. Benefits are offered all through Delta Dental. That's our carrier of choice. And then we also have adult vision through eye care, which allows up to $150 allowance. And I'll get more into that. I have, like a slide or two in regards to that. But eye care, just so you know, is part of the VSP network. So that's the biggest network nationally throughout the United States, basically. All right, moving forward. As far as our pharmacy network is concerned, the Express Scripts. What that means to you guys, just keep in mind, we have affiliation with all the major pharmacies, CVS, Walgreens, Publix, Walmart, Costco. So wherever your customer wants to go get their prescriptions, they will be on in network within those different pharmacies. Formularies, obviously, your responsibility as the agent is just know your client and especially if they're sick, see what medications are covered under the different tiers, but pretty standard, just like any other carrier. We have tier 1 through 5 lists, so that's probably more on the agent's responsibility as far as if your customer has a specific illness that they need to treat. Just make sure you check with us, and I'll provide my information at the end. You can reach out to me as well, and I can help you out with those different questions if you need to. Uh, and then we're always going to promote a 90-day retail for your pharmacy. The reason why is because we're always going to promote discounts for your customer. They're going to be able to get those discounts, the longer they order their supply. So keep that in mind, and that won't be the last time. There'll be other slides in regards to that 90-day supply. As far as our telehealth, we use MD Live, and then as far as our lab companies, we use Quest Diagnostics. So when you're talking to your customers, make sure that their doctors are referring them to the Quest Diagnostics to get their lab work, so that way they stay in network. All right. Going into open enrollment, these were the plans, how we were looking according to the marketplace. So you could see the reason why we were a little more competitive in these markets. Um, in these markets is because we had a lot of decreases and very minimal increases, right? As far as maximum out of pockets, deductibles, even on the PCP as far as copays and so forth, the increases aren't too much and pretty much in line with any other ACA carrier out in the market. So you can see we had a lot of green. So that really led to our growth this year. So we increased our membership. Not only throughout those counties that I showed you previously, but in general, overall, we have increased our membership. Um, So that's probably if you guys are new, if you guys are previous agents, basically this might apply to you. So there was a few plans that were discontinued. The Silver 300, Silver 300 with dental, the Entrust Silver 500, Silver 500 dental and vision, and the Silver 500 the off exchange. I think probably if you guys are previous agents with us, that probably is the one that affected you guys most, and the Bronze 625 dental and vision. We did expand. We're one of the few carriers that does have platinum plans. In case your customers really want that $0 deductible and so forth, we do have platinum plans available on the market, and they did do pretty well in the different service areas that we do service. So you can see here in the service areas 1 through 5, basically. Service area 1 being Miami-Dade and Miami-Dade, basically. Service area 2, Broward, Palm Beach. Service area 3 more central, like the Orlando area, Osceola, Seminole, uh, service area 4, which is on the West Coast, more Tampa based, and service area 5, which is going to cover more basically Jacksonville and also the Gainesville area. All right, moving forward here. So engage and empower product overview. Healthcare without boundaries. So our off exchange engage and empower product details. Basically, the engage is an HMO and the empower is a PO. So remember, we're talking off exchange. Keep in mind, only residents of Miami-Dade and Broward County are really available to use these products. We're trying to expand these into different counties for next year, but right now they're only available to your Miami-Dade and Broward County residents. So in terms of cities, Fort Lauderdale and Miami, basically, those are the areas that those two products off market are available. Remember, the Entrust is the one that covers our entire market. That is our ACA product. And